Hi, welcome back to Rohrich Knows Podcast. The business of medicine. That sounds like it's so commonplace, and yet it's rarefied air in medicine and in plastic surgery because no one is taught the business of medicine. And medicine is a huge business today. And yet our trainees, whether they're in medicine or plastic surgery, we're not taught that in medical school or residency, which is really not a good thing. But there are always bright spots. And today we have an incredible, bright, intelligent plastic surgeon, Dr. Jordon Frey from Buffalo, New York, who's an expert in breast microsurgery and a talented plastic surgeon. Welcome.
Thanks for having me. Excited to be here.
So he's now in his fourth year of practice, right. And he is the author of and the founder of the Prudent Plastic Surgeon. And, you know, he's going to tell us his journey on how he scripted into learning the business and art of how to become successful in plastic surgery, but also in medicine, and what are the gateways and also the traps that you want to avoid in the business of medicine. So Jordon, tell us a little bit about your journey. I know you've been in practice for 4 years, but we're going to approach it from a business aspect. So tell us about why you formed this entity, the Prudent Plastic Surgeon, and what you're doing with it and how we can help you.
Yeah, my story with the business and kind of finance aspect of medicine in general started about 4 years ago. I was finishing my training. I did 6 years of plastic surgery residency and then a year of microsurgery fellowship. And as I went through that, I was totally oblivious to finance, to business and medicine, et cetera.
Which is normal.
Many of us are.
Yeah, which is normal. Yeah.
Yeah, we don't learn about it. And on the contrary, we're sort of actively steered against it because we're kind of told, and there's this taboo, like, if you think about the business aspect or think about money as a doctor, that's not good because we didn't get into it for the money, which is true, but is not mutually exclusive to being a good physician. And I'll talk about why I think actually it's really important to being a good physician. But basically at this time, when I knew nothing, etc., I was about to finish, and I found myself burned out before I even started practicing, and that was really surprising. That wasn't something I thought would happen to me. And when I looked at why and introspectively kind of thought about this, a big reason was a lack of financial well-being. I was finally about to graduate, reach all of these goals that really for the majority of my life I'd been working towards, and I found myself like not feeling as excited. I had people saying, oh, this is it. This is going to be fantastic. This is going to be great. And you're finally going to be making money. This is awesome. And internally I was just saying, no, you don't understand. This isn't great. I have $500,000 of student debt. I have credit card debt. I have no investments. I have a young family. And I have no idea how to go about this.
I'm broke.
My salary is going to increase, but everyone's just telling me I need to buy a big house and fancy cars and suits and all this stuff to meet the image of a plastic surgeon, and my expenses are going to shoot up even more than my income, and I just don't see a way out of this, and I'm feeling stressed about it. So I finally recognized that that's what I was feeling. And so my wife and I said, this can't be right. Like she was getting her PhD. I was finishing up my residency. We're like, there's no reason we should be like this. If we can't, feel financially well, then who can, and we've worked so hard for this. So we started just reading books and blogs and learning about personal finance and things that retrospectively seem really silly, like you should save part of your income. That didn't seem obvious to me, just based on my upbringing and things like that, and I wasn't practicing it for sure. So silly things like that, saving and investing, etc. So we learned about that. We put together a simple financial plan. Again, just saying we're going to save this much percent of our income, we're going to invest it this way, and that showed me there was a real way to reach financial freedom, or this idea that I could work and practice medicine because I wanted to, not because I had to. And that was so liberating. And I was still in training, so nothing externally about my situation changed other than having this plan that said, hey, in 10 years, whatever, you can reach financial freedom. And I found myself with that. My burnout improved, my financial well-being rose, and I honestly found myself being a better doctor because I wasn't encumbered by all of those other things that I was feeling about
Right.
Financial insecurity, which sounds ridiculous as a high-income to be individual, but a lot of doctors feel that because of the debt that we have and the lifestyle spending that we incur. So that was eye-opening for me because, again, I'd been told thinking about money is not compatible with being a doctor, being a good doctor. And I found I actually was becoming a better doctor, not harboring resentful feelings towards medicine once I started doing it. So that was really eye-opening and led to me sharing my experiences through this website.
Right. And the amazing thing, Jordon, is that's like a life epiphany because I trained a couple of decades before you, but I had the same feeling. Isn't it crazy? Nothing had changed in medicine for over 20, 30 years. I came to Dallas, I had over $400,000 in debt because I also did a couple of fellowships abroad in Boston. I mean, because I didn't think about that either. I mean, so nothing had changed. It's unbelievable. And of course, when I came to Dallas, the interest rates on the first house I bought were 14%. Oh my God! So we're thinking, oh, it's high at 6. Give me a break. So nothing. When I'm listening to you, I'm saying, wow, I had that same experience. And you're right. When we were in school and in residency, we said, oh yeah, you really can't talk about Medicaid because then you think you're like a greedy doctor. And really, you actually, it's part of being a good physician because you can't live out of your car. I mean, I guess you can, but not as a physician. And you got to take care of yourself and your family if you're going to really do, if you're going to do great things in medicine. So all those things are kind of basic, kind of 101 things, which we all learn the hard way. And I think what you're saying is it doesn't have to be that way. And that's why you did the Prudent plastic surgeon, right?
Yeah, exactly. I thought what I was going through was really
unique.
Unique. Yeah, that it was just me. And before I started talking about it, as I started, just learning more about it, and people would kind of ask, hey, what are you reading, or why are you getting into this, and saying, I'm feeling the same things, and I realized, it's just something we're not talking about. And so I started writing about it on this blog, and it took off, which has been really, really fulfilling to be able to share and kind of, learn about so many other people's story. And I'm still learning. I'm not financially free yet, but just going through the process, it's been so much fun.
Tell us about your blog. Tell us about that. It's kind of like you're like a little mini Dave Ramsey for plastic surgery, right?
Yeah.
And he's great too,
yeah,
by the way.
I basically started it. I never blogged before. I enjoyed writing, so I just learned how to set up a blog site and started sharing my experiences and all the mistakes I made and what I was doing to try and improve them. Really because I was just in a bad spot, and I figured, hey, if I can figure out a way to get out of it, then just about anyone can, and there's nothing so special about me. So I just started doing that, and like I said, it seems to have resonated and taken off, and so
how do you find your blog?
To be able to share it.
How do you find your blog?
If you go on just www.prudentplasticsurgeon.com, you can find it. And there's a lot of, I also do a lot of work with Doximity and MedPage, so a lot of it's on there as well. So any of those avenues are good ways to find it.
And you know what people say is, if you recognize the problem, you've halfway solved it.
Yeah, that's the biggest part, because again, I didn't even realize this is what I was feeling and leading to this burnout, which is this horrible, horrible feeling, because medicine really is such an amazing specialty. And that's why I always say there are a lot of external factors that influence medicine today. And I think my generation has done a not great job of allowing medicine, the control of medicine, to escape away from doctors. And I think financial freedom is really this amazing path to get control back, because imagine a nation of doctors who just would be able to work because they wanted to, not because they had to. They wouldn't have to put up with administrators and insurance companies in the way that they are managing things. We could just say no. We could say, listen, I'm not doing it that way. I don't have to do it that way because I don't need the paycheck. We could really start redefining what medicine was like in the U.S. and making it better, I think. So to me, it's even bigger than just the personal side, which I think is really important. I want every doctor to have better personal well-being, but it's for the whole field.
So how do you get started? So obviously you're going to your blog. So what advice do you have for the young physician, the plastic surgeon that wants to get more business savvy? What are the top 3 books you should learn, or what are the top 3 things you should do?
Yeah, I think one, which you alluded to, is you have to learn about this. We think finance is a really difficult kind of topic. It's not. The things we do as physicians is like way harder, obviously. So you just got to learn about it. You can use my blog, any other blog. There's lots of great ones out there. Lots of great books. I actually just published a book in the past year, Money Matters in Medicine. So that's a great one you can check out. One of my other favorites.
It's on Amazon?
On Amazon.
Yep. Well, we'll plug that.
One of my other favorites is Millionaire Next Door, or The Coffee House Investor. You just want something. And so to start out, I just read 10 pages a day, just tried to read one book a year to learn about this stuff. Then 2, and again, you can go really into the weeds with personal finance, but as anyone really this applies to, but especially as a physician, which we're blessed to be very high income professionals, if you save 20% of your income and invest wisely, I'll say. For me, that means investing in index funds largely. But if you save 20% of your income and invest wisely, you will reach financial freedom. So that's a huge concept, which is really simple. That's just 2 steps right there. And so anyone can implement that. And I think the third that comes in is this idea of intentional spending as a physician, and what that means. And it took me a while to kind of understand this. But as a physician, again, we're blessed. We're high-income professionals. We could buy pretty much anything we want because banks are willing to lend us an incredible amount of money. So, you can have anything, you can buy anything, but you can't buy everything. And I think that's the problem that people get into. So you really want to think about what's important to you and how you want to spend your money. Because again, living up to this image of a plastic surgeon, you can kind of go crazy. And that's when people get into this spiral of they have all these expenses and then they're burned out, but they have to keep working because they need the paycheck, and they become worse doctors, and they're providing, I think, worse patient care, and that's what you really hate to see.
I totally agree. I can tell you, you have to become debt-free, and you can't become somebody else's image. You have to live in your own image, and that doesn't mean you should be driving a Mercedes in your first year out, which I think is ridiculous. I think you should do what works for you, because you can still get to work with your Toyota or whatever you do, and of course I live in Dallas where my kids' friends were driving Maseratis when they were 16, and I'm going, wow, you got to learn from that. But it's so crazy out there. So I agree with you. So, and don't you think becoming debt-free is very important, because that's liberating to you?
That's huge.
And I don't agree with all of what Dave Ramsey talks about, but some of that is very important, because you want to make sure you're financially free for you and for your family. And just like you, it took me years to dig out from my $400,000 debt, and now and once you do that, you actually become even a better physician, because you now are doing things because they're the right things. When I talk to my patients, I say, I'm just here to educate you about the things that I think would benefit you. I mean, it's totally up to you, especially in what I do. Yours is more of a need surgery. You're doing microsurgery for breast cancer and things. They need to have that done. What I do doesn't necessarily have to. It's a want surgery, your nose job, your rhinoplasty. But I think we should, and it emulates, people know when you're talking and trying to sell people something. I've never ever sold any patient anything. not even when I was doing reconstructive surgery. I say it would highly benefit you, but you just say these are the best options, and I can do this for you. So what do you think are the next steps? Okay, so it's obviously investing wisely, putting away 20% of your income, and index funds are great. And maybe then if you become more savvy, and I personally never trust any one financial planner. I think the best financial counselor is you.
Yeah,
and never invest in something that you don't understand. How many scams have we all in plastic surgery, become a victim of? And I could list about 5 of them that have taken millions and millions of doctors from some of my smart friends in plastic surgery. But whenever I see something and I don't understand it, I don't do it. Don't you think that's good advice?
That's you nailed it. And I bring that back to plastic surgery when I'm talking to residents. And I always say in medicine there's 2 kinds of surgeons, let's say plastic surgeons. There's simplifiers and complexifiers. Like when I learned from you a rhinoplasty, I can look at it and I go, yes, that makes sense. I can follow that and do that, and I understand it. And there's other people where I watch their presentations or I've heard them talk, and I go, phew, I thought I understood that, but man, I don't think I get it anymore. And there's the same thing in finance. There's
right.
simplifiers and complexifiers, and in both, it's the simplifiers who really understand things, who are able to break it down to the key components. And I always say in finance, like, if you're listening to someone about an investment and you don't understand that investment or what they're saying, there's really only 2 options or 2 reasons. One is that person doesn't understand it themselves, which obviously that's a bad scenario. Or 2 is they're trying to make it seem so complicated that you feel like they're the only person that can do this, and you need to give your money to them to do this, which is not the case. Any investment you can do just as well as anyone else, and that doesn't mean you don't need help. I liken it to landscaping. Like, I know I can landscape, I can cut my lawn, I can whatever, I just don't want to do it, so I pay someone else a reasonable amount to do it. If that's finance for you, that's okay too, but you still should understand it, and if 100%. You needed to be able to do it yourself.
Otherwise, because honestly, physicians are the biggest suckers in the investment market. They are. I mean, you get all these calls, and I always laugh at people that talk to me that because how you learn. If you don't learn from your mistakes, you're going to repeat them again and again and again. It's called the definition of insanity that Einstein talked about. If you do the same thing over and over again, you're still going to get the same results. So in wrapping up, Jordon, this is incredible advice, and obviously we'll have you post your blog site. So what are the 3 things that, as a young physician, young plastic surgeon starting out, that they must do, absolutely mandatory, to become not only debt-free but just live a better life, both financially and personally? What are those 3 big things?
I think you want to think intentionally about the life that you want to live and the values you have, and make sure your finances reflect that. Don't spend money trying to meet anyone else's image of you. Right. I'll give a quick personal anecdote. I'm not a person that enjoys cars, so I have a very simple car that I bought for $4,000. It works great. It does what I need for it. But on the flip side, I was coming from New York City in a very small apartment. By the time we left, when I was a trainee, we had 2 kids. They were in the bedroom. My wife and I slept on an air mattress. We wanted a nice house. We wanted a yard. So we bought an expensive house, but it fit in our budget. It fit our values, etc. So I'm not saying don't spend money. I'm just saying spend it intentionally. So I think that's a big one.
So live within your means and mean it. Okay.
Yes.
Okay. Number 2.
Number 2, you already said it. Have a plan to get out of debt within, I would say 5, but at a minimum 10 years of practice. Because once you do that, then you really can start accelerating your journey. And number 3 goes back to what I said before. Just save a relatively small amount, 20%, starting out, and invest it. It's much easier to save that 20% when you're starting out than say, well, I'll start doing that 5 years out. Because once you accrue the expenses, it's very hard to pare them back. You really kind of want to just start out having that cushion for yourself, and you'll be fine. If you just follow those really simple things, you will reach financial freedom. You will be the best doctor that you can be.
Fantastic. prudent words from the prudent plastic surgeon, Dr. Jordon Frey. So thank you so much
you.
for taking the time to do that. Stay warm in Buffalo, and I've always enjoyed talking to you, and we're going to have you back on Rohrich Knows podcast.
Sounds good.
You
Feeling's
bet.
always mutual. Thanks for having
Likewise.
me.
All right. Take care. God bless.